So the last time we talked about metabolic acidosis, but then we said that metabolic acidosis is when there is an increase in the buildup of metabolic acidic waste products, basically waste product of metabolism. And that buildup can be as a result of increased production or decreased excretion, which makes sense, right? So now what we are going to discuss, what are the conditions that would lead to increased production of metabolic acidic waste products. The first one and the most common one is diabetic ketoacidosis. Now, what is happening in diabetic ketoacidosis? In diabetic ketoacidosis, there is a buildup of ketone bodies in the blood because of person has had a long-standing diabetes. And what are these ketone bodies? The first one is beta amino butyric acid. Second one is acetone, and the other one is acetate. Acetate is another name for acetic acid. So you can see that these ketone bodies are acidic in nature. And when someone who has diabetes has a buildup of these ketone bodies, it results in metabolic acidosis. The second one is lactic acidosis. Now, what is happening in lactic acidosis is that there is a buildup of lactic acid. And what would cause a buildup of lactic acid in the body? When there is muscle hypoperfusion. When there is muscle hypoperfusion in the body, then it will result in the muscles using up the stored glycogen to produce glucose and resulting in a process whereby the muscle is releasing lactic acid into the bloodstream, resulting in lactic acidosis. And that condition is alcoholic ketoacidosis. When someone is a chronic alcoholic, has been taking a lot of alcohol, how the body excretes or deals with alcohol in the body is by converting it to an acid. And the name of that acid is ethanoic acid. So when someone takes a lot of alcohol, there is buildup of ethanoic acid in the person's bloodstream. Finally, when there's an ingestion of acidic substances, ingestion here just simply means when you eat, either through mouth or through IV, intravenous or intramuscular, anyhow there's an ingestion of an acidic substance in the body, it can build up. Example, when you take naphthalene, when you inhale it, it can cause an acidic buildup in your bloodstream. Aminoglycosides, these are drugs. When you take this kind of drugs, whether you ingest it or you get injected by it, you can also have it. Methanol. There's something known as methanol poisoning. In fact, it's even much more dangerous than alcoholic poisoning. And other drugs that are acidic in nature. Example, isoniazid. Isoniazid is a drug used to treat um, by tuberculosis, an antibacterial drug used to treat tuberculosis. If you are taking a lot of this drug, you could actually have metabolic acidosis. Thank you.